All right, good evening, and thank you all for joining this evening. We'll go ahead and call this meeting to order. It is 7:01, and can I get a roll call, please?
Yes, Member Downs,
Here.
Member Gary,
Here.
Member Hamady,
Here.
Member Johns. Member Johns, I know you're here, but we want to do an audio check to make sure we can hear you. I'll come back to him. Member Leon is absent, excused. Member Locke,
I'm here.
Member Newton,
Yes, I'm here.
Member Oliver,
Here.
Member Wong, looks like absent. Member Wright,
Here.
and Member Johns.
Here.
Yes, he's here. Great.
All right, thank you all for our roll call. Are there any public comments at this time? Let's open it up for 3-minute public comments for things that are not on the agenda. Looks like there one. Go ahead, please.
Yeah, hi, good evening. My name is Jeremiah. I'm a member of the Albany Social and Economic Justice Commission. I'm a commissioner, but I speak for myself. I do not represent the SEJC. So I was wondering if someone else's microphone is on. I'm getting some chattering cross noise. It's hard for me to focus. So I just want to talk about public records requests and why the Albany Police Department is able to deny public records requests. I didn't know if that's possible. I always thought that, Albany's police core values, integrity, all these core values the police department has. What about transparency? That should be a core value. It's transparency. Did you know that Albany Police Department has this government code section 6254 parentheses F? It states that basically police departments, if they don't want to, they don't have to give public records requests. And I would just wonder why a police department would go so far into not wanting to give a public records request to the public. And that code I gave you actually even gives the police the power to deny a public records request to the media. Do you know that? That means the news can't even find out what's going on. Something's odd about that. There's a Public Records Act and also the Ralph M. Brown Act. Those are two primary status promoting transparency in local government. So I'm just wondering why this penal code exists, and it shouldn't exist. Public records requests is, what is a public records request called? It's called the public record because it's public record. So I'm just kind of curious on this whole government code that it's basically the police department's excuse. This is the excuse they can give to deny the media and the public if they want to cover something up. That way nobody knows. And that's what's happening. That's what's happening right now. So hope everybody wakes up.
Thank you so much for your comment. Is there anyone else?
That's all.
Okay, seeing that there's no other public comment, we'll go down to line item number 4. Are there any announcements from staff or the task force members?
I'm sorry, the two people raised their hand, right?
Okay, let's go back and get their comments. Thank you.
Go ahead, Margie.
Hi, this is Margie Marks. I just wanted to thank all of you for all of the work you did on this commission. And as a member of the public, and I hope there are other members of the public out there, I'm not going to let your work, this be the end of this. We have to keep this work going in our city to make our police department what we want it to be. So I just really want to thank you for doing all the work that you have done, and I really appreciate it as a citizen of Albany, and we're going to keep it going. Thank you.
Thank you so much, Marjorie. Next, please.
Oh, hi, my name is Kathy Rye, and my sentiments I'm going to echo with Margie. Thank you so much for doing this work. If it weren't for you, I wouldn't even be knowing any of these issues existing, because I know of people that have tangled with the police, and I actually read the public comments. I think it was all 78 of them, and noticed that I think I might have miscounted, but it looked like 19 of them were actually very thoughtful and really echoed a lot of the sentiments that, yes, transparency does seem to be necessary. And yes, I do appreciate very much your work. One suggestion, and I'm sorry, this is my first meeting, it probably was brought up before, it would be helpful. I loved that, I don't know if it was you that put that survey together in terms of choosing unarmed responses to mental health issues. That was a really, really great set of questions, and thank you for doing that. I really appreciate that, because it is so true, because if it saves even one Albany resident from going to the dehumanizing conditions of Santa Rita jail, I'm just a dumb mom just poking around, and all I did was a Google search, and it came up with 3 cases just in the past 6 months of such blatant abuses that the judge found in favor of the inmate. And if the armed police treating Albany residents like hardened criminals is a response for an argument between a husband and a wife that should have been a mental health crisis issue, there is an 800 number that my therapist told me about that should be very, very public instead of an Albany Police Department response. So I don't know if you're aware of those conditions, but they're deplorable. He was moved into 12 different rooms because, she froze, and she just couldn't respond appropriately when the Albany police said, okay, do you have a hotel or a place to go to? Because they perceived it as a domestic violence situation, that she was being hurt, but she was just triggered. And they basically decided, okay, one of you has to go to jail. And, so he ended up volunteering to save her from going. But he was kept for 8 hours. It's cold. He was moved to 12 different rooms, not allowed to sleep. There's shit on the walls. I don't know if anybody's aware that this is what's happening and potentially can happen to Albany residents. So I don't know. This is my very first meeting, so I'd be very curious. You've probably hashed this over many times, but I wish I got involved, and I've been part of the conversation soon. Thank you.
Thank you so much for your comments.
Okay, I think that's it.
All right, thank you so much. Again, we're going to line item number 4. Any announcements from task force or staff members? Go ahead, Member Newton. You're on mute.
I guess this is the place to say what I wanted to say.
Okay.
Member Leong can't be here tonight, sadly, and for a very good reason. I mean, her dad passed away, and she has been sort of the hard worker in our subcommittee on the budget and data. And she'd done most of the work that we presented to the full task force. And I wanted to get some of it clarified. She wasn't around to do it with the chief of police. And I asked him for a meeting and send him the documents that I wanted him to talk about. But I haven't talked with him yet. And it isn't his fault. He was out, the chief was out all last week taking care of his wife who had had surgery, and he's busy. And I didn't give him enough time to respond. But so, I mean, we'll still use the documents that Yvette produced. I wanted to just briefly, I wanted to get the chief to talk about the study that Yvette dug up on the 73 biggest police departments and how many cops they have per person and what their budget is. And if he thought our conclusion that Albany is possibly over-policed, from his point of view, is it accurate? And of course, I didn't get any answer because I haven't talked with him yet. And it doesn't really make any difference. Really, I mean, I think police chiefs are, in general, are always wanting more police officers and saying that they don't have enough police officers. But we were hoping to get that $1 million that we've been talking about that might be there, that's budgeted and not used for full-time officers. And I wasn't able to get him to specifically talk about that either.
Member Newt, can you hold off until we get to the budget and go into?
Okay, yeah, all right, sure.
Can you hold on? We'll get to that line. Okay, no worries. All right, are there any presentations? Oh, and did you have an announcement? Yeah, go ahead. I'm sorry.
Yeah.
Go ahead.
Yeah, thank you. I just wanted to let all the members know and the public know that per city council direction, this will be the last meeting of this task force. I want to thank all the task force member for the last 9+ months of participation in local government. Thank you all.
All right, thank you so much, Ann. Now we'll move down to line item number 6. We'll go to 6-1, which is the Reimagining Albany Police Safety Subcommittee Memorandum. So, and if you can put that memo up, we'll go ahead and just go through it briefly. If there's anything we need to add or vote on, Member Hamady, if you could take the lead on this and just let us know if there's anything else we want to include in this memo before it goes to council, hoping in March. It will not be on the February 22nd agenda as we voted for.
Well, yeah. So I'm not at a computer, but the outstanding change that I think needs to be voted on, I think was mostly due to an oversight. We left the crisis response team within the police department, and I think we had talked about moving it to the fire department instead, and that would correspond with the reduced funding of the police department, because obviously if we're reducing funding by whether it's 25 or 50% and increasing funding for community programs such as the crisis response team by a commensurate amount, that doesn't make sense if that program is within the police department. So I think obviously I had hoped that we could have it as an independent department, but as a compromise, we had discussed having it within the fire department. So since I don't have it in front of me, I can't insert the changes, but the proposed change would be just specifically to locate the crisis response team within the fire department rather than the police department.
And is that in the document before us?
I don't think so. I think we had left it, we had removed that piece of it, but you'd have to double check. It's in, in where the section on the creation of the Department of Public Safety and the crisis response team. So it'd be towards the beginning of that.
Hold up. I think it was in number 1, Ann, where it says crisis response team, the city shall create a crisis response team with the police department. So that should be fire department versus police department?
Yes.
Any task force members have any concerns or an agreement so we can change that?
If it's a motion, do you want a second?
Well, no, I just want, and if you can change it from police to fire so the members can see what we're speaking about. And then, yes, we can get a motion unless there's discussion regarding this change.
Sorry, I need to put it in a different format for it to,
Okay,
for me
thank
to
you.
be able to change it.
You got it in? Okay. Let's see. We'll change that to fire department. Team should be on. I think scroll up. I think that's the only place. You want to scroll down. Okay. Were there any other changes or updates, Member Hamady?
No, I mean, I think that was the key one. There is one, I don't know if we want to clarify. I think right now it says that emergency calls would go to either the police department or the crisis response team. And there are obviously other kinds of emergencies that could arise, like specifically fire or EMS. I don't know if we want to add those or, it's not, obviously it's not as if this document will eliminate those options, but for comprehensiveness sake, maybe we should insert those two possibilities for where the calls would be routed. And actually, because the crisis response team would be located within fire, I don't know that we necessarily have to even mention the crisis response team specifically, but as it stands right now, it seems incomplete.
All right. Any other thoughts from any members regarding the 911 calls? Does that sentence read clear to everyone? Any changes, addings?
Can I just ask? Oh, go ahead. It looked like somebody else was going to say something.
Go ahead. Go ahead, Member.
Can I just ask Member Hamady, do you want to just frame it as a revision? People can, so if it says non-police clinical experts will staff the call center, it doesn't sound like you're asking for change there. Funneling calls, is it just you wanted to say funneling calls to either police department, fire department, or crisis response team? Is that literally what you're asking there?
Yes, and EMS, emergency medical services.
Okay. So that, yeah, I'm glad to second that as well. If we want a motion on the two things that Member Hamady has mentioned, I'm glad to be a second or to construct the motion.
Okay. I just want to make sure that we have everything intact before we complete.
I'm sorry, how do you want the sentence to read?
Member Downs?
Okay, I'm sorry. I thought this was for Member Hamady, but I think I was just trying to follow his suggestion that it say funneling calls to either police department, fire department, EMS, or crisis response team, just to reflect, that calls could go to any of those directions, which is, as Member Hamady, as I understood him to say, is something that's inherently true anyway. So it just reflects that fact.
Yeah, thank you.
Thank you. Any other suggestions before we go ahead and take a motion on those changes and we'll finalize this document? All right, we'll go ahead and move forward. Can I get a motion? You know what, hold on before you do that. So where can we put that? And this is, I'm just throwing it out that should there be a special training for these calls, or do we want to put that in there just to be clear? Or what are your thoughts for the crisis response team, or like how, I guess I'm trying to figure out what training will be needed in order to determine which goes where, or is that something we want to include? No? Yes?
This is member Locke.
Newton?
I'm sorry. No, I did have some thoughts on that. I think that's sort of intrinsic to this plan, but I concur with Councilmember Gary's observation. Do we want to specify that in this document, that there will be training of the staff, these non-police employees, that will allow them to properly distribute these calls or in this dispatch function? Do we need to add something to this point number 2?
I think there should. I think there should be, but I'll defer to the other members of the subcommittee if they are in agreement with that as well. But I think there should be some type of language to state that, just so we're clear where these particular calls will go. But it has to be some type of training involved, and I don't know if we want to specify the length of training or what, but there needs to be something in there that states that as well.
Excuse me, I'm confused. Are we moving the call center out of where the police department? And I mean, I thought we weren't doing that. I'm just confused. What have we moved it? The whole emergency response call. The first somebody calls the city and they've got a problem. Do the call go to this not police officer, not firefighter person, and he refers the call? Maybe I'm missing something here.
Remember, how many? If you can bring clarity to.
Yes, no, that was voted down. You're correct, Member Newton. I think there is some confusion, I think, with the training piece of it. Obviously, if there was a new group of crisis response team members, they would have to be, they would be trained. If you want to insert training in there, that's fine with me. But no, this is so that the call center is still going to operate within the police department. That was the controversial piece of it. The crisis response team will operate within the fire department, and calls will be routed to them, among others. So it doesn't have any major structural changes. And I don't know, one, Member Newton, you're correct. Nothing has that, we're not changing that. So we don't need new training for dispatch, because dispatch is not changing. That was, what was voted down. If you want to insert training for crisis response team members, obviously that's perfectly fine.
I think, Member Oliver, you have your hand up.
Yeah, well, I just wanted to add, my understanding was the thing that got voted down was the creation of a separate public safety department. So that got voted down, but there's still the part about the call center, the non-police employee staffing the call center. So I guess I just wanted to jump in. That's my understanding. So there isn't a separate public safety department, but it is a non-police employee staffing the call center, which is two different things.
Anyone else? All right, so I just would, and if you can just add a line, just basically saying the crisis response team members, employee will have to undergo training.
It's still not clear to me.
Okay.
Member Oliver is saying that the first person to receive a call from somebody in the city who's got some sort of problem will go to a non-police employee. I didn't understand it that way.
I'm just reading from the thing because that's what it says right now. which is what we agreed on last time.
No, it isn't.
I mean, I'm just reading from the screen. Non-police employee, clinical experts will staff the call center for 2A. But that doesn't mean that there's a separate public safety department, a separate bureaucracy.
Well, but does it mean that a non-police employee will be the first person to get an emergency call, and that person decides whether to toss it to the cop sitting next to him or toss it to the firefighter who's trained to be a crisis person? Is that the way you see it? So, I mean, it's the same thing, except they're just not moving into another building. They're just going to share, I guess.
Yeah, I mean, that's how I understand it, just based on what it says on the document, which is what we agreed on last time.
So basically, just for clarification, so whenever we call 911, someone call 911, whether it's for police protection or some type of medical injury or something from the fire department, the dispatcher will get the card. What is your emergency? I have a mental issue going on in my household. That call is going to go directly to the crisis response team to deal with that. How are they going to deal with that? There has to be some type of training, right? So we'll have a specialist or employees that understand how to deal with that particular area. If another call comes in and the police are needed, that call will go to the police department, right? If a call is needed for a fire, that's going to go to the fire. So it's not separating, it's just basically redirecting so the right team is responding for the right issue. Does that make sense? No?
No, it doesn't make sense. So I'm just trying to figure out, I mean, if just a stiff lives in the city, like me, calls 911 and says, my next door neighbor is killing her husband, who gets the call?
Well, if there's a murder, I'm hoping that the police and the crisis team will work hand in hand together. Because one, you're going to get the police there to protect that person with their weapon, right?
Yeah.
But then the wife may be undergoing crisis, right? It's very emotional. So you don't want the police to handle that. The caller just gave an excellent example of how there was a domestic violence, right? Confrontation between a man and a woman. And so they intervened, but they still end up taking the man. But that woman still needed that type of intervention. Where does she go? Direction, giving them information. So while the police is handling the suspect, that woman or that man or whomever it may be that's in trouble, the crisis team will be there to give them the support they need, give them the phone numbers, possibly take them to a hotel or something. I think that's kind of where we're going. If I'm understanding it correctly or incorrectly, someone please jump in. I think Member Locke's hand is up.
But I don't mean to be flippant, but I still don't get it. Who answers the telephone? Is it a police dispatcher who's been trained to divvy up the calls, or is it another person? Is it not a fireman, not a policeman, somebody else that we have to hire to take care of that? Is that the first person to answer the phone?
So when you call, the first person to answer the phones is a dispatcher from the police station. 911, that's where it's coming from.
Okay, that answers my question.
Okay, Member Wright and then Member Locke.
Oh, I was just going to try to provide some clarification that by removing them from under the police, we're emphasizing more of a community service. Though the training, the dispatcher who is not trained, from my understanding, to be a patrolling police officer would get additional training in counseling, plus additional crisis person would be on hand. So what we're doing is expanding the community service level. So the person who answers the phone would technically be the same, or could be the same person, with additional training to expand our community service responsibility.
So I guess my question I was going to ask to clarify Member Newton's initial question was this: under the current state, when that initial call comes in, the individual that answers the phone, that answers that 911 call, and Member Newton, correct me if I'm misstating your question, is that person a police employee, or are they not a police employee? Is that what you were trying to get at? Member Newton? Under the current state.
Yes, that's was my understanding.
And if so, then the document as presented under 2A makes a change to that, in that now it is a non-police employee clinical expert who's picking up that phone or answering that call. Is that
That's
to
yes,
the heart of your question?
that was my problem with what was presented.
Okay, so would you like that to read, instead of a non-employee clinical expert, I guess we maybe should put dispatcher, or how would someone want that to read? So there's clarity on who's answering the phone to direct the calls to the particular department based on the crisis.
Well, it has to say something like a dispatcher with extended training or specific training.
Okay.
Answers the calls. I mean, do you see what? Does anyone else agree that if we
No, I
say
agree with what you're saying. I think in order to bring clarity, so there's no room. Thank you for picking and pointing that out. It needs to read well. So if it needs to say a dispatcher is to answer the initial calls, then transfer to the particular departments, we just need to put it down in writing so it reads well.
I mean, I respectfully disagree. I think if we want to say a non-police employee clinical expert dispatcher, if we want to add the word dispatcher, I think that could be helpful if that would be clarifying. But I guess I currently think it's clear as it currently reads, but if we want to add clinical expert dispatcher, that also seems fair.
I think the disagreement here goes towards what Member Newton is saying, was that there's a lack of clarity on whether or not we agreed that there's a change to the identity of the person that's taking that initial call from currently they are a police employee, now as it reads to a non-police employee. So I think that's where the dispute lies right now.
You bet. It's a major change. It isn't.
No, go ahead, Member Newton. Go ahead.
If we agreed last time to change that we weren't going to have a separate call center and separate different bureaucracy, I think this establishes that different bureaucracy just within the current building. It's by saying a non-police employee. I think we use the dispatchers that they have, but give them extensive and specific training to deal the calls to the right people. Instead of a knee-jerk, it's a cop thing. The person is trained to understand the difference between the two. And if I'm overstating, I don't want to speak for anybody but myself here. If you're in disagreement with that, then it's understandable, but it would change things.
I think all the time that you spend working in the subcommittee, you can speak somewhat for the subcommittee, and I can support you in where you're going with this in terms of what we're trying to achieve. What we're trying to achieve is, how do we reduce the police budget without impacting the community safety? And one of the things is, one of the problem we have is how does the training that the current group of employees who answer the phone impact our community? Do they call the police first, or do they call community service, for lack of a choice of a better word, crisis center? So what you're saying is keep them under the police umbrella and give them additional training so we can serve our community. Am I interpreting that correctly?
Yes. Yeah. And I'd love it if we had some way to make sure that they were doing that, but
Well, then we have to build the process in to make sure they're properly trained. I think what and from my understanding of the document is we're saying we know that there's some money sitting someplace, and rather than have this bloated police budget, we shift some of it over to the fire department. And that somewhat could make sense and make sense because if you make a call and it goes into the 911, they'll determine if it's an accident that needs fire or 911 or an ambulance. All we're doing is shifting into a space where we believe that more proper training would probably take place versus this enforcement type of training. And it's all about what added value we're putting onto the dispatchers. Am I making sense? Or did everybody hear? Basically, what we're saying is we move it to the fire department. We still would have to give them additional training, but the culture would change from being an enforcement type of culture to a culture of service. But the fire department is known for a culture of service, and we're moving this department, we're moving a group that is under one culture to a different culture with additional training to make them serve the community better. That's what we're trying to do.
Yeah.
So you could change it from non-police employee clinical experts to fire department employee clinical experts would staff the call center. That seems to reflect what Member Wright was saying.
Okay. And if you could put that, please, that change. Is everyone in agreement with that? Or is there more discussion needed? Okay, are there any other changes?
Member Downs, do you agree with the changes as they are? Will you still second it?
I do. I can see both sides on the last piece, but I do with the way that I understood Member Wright to make that case.
Okay.
All right, can we get a
I
motion?
could be wrong.
All right, can I get a motion that this final document will go before council as is with the changes already implemented?
Yeah,
I'll make that motion, or it looked like somebody else was.
I'll second it. Sure. We got to get something done.
Member Jones, go ahead. Thank you, Member Newton.
I'm sorry, so Member Downs made the motion and Member Newton seconded?
That's correct.
Member Downs?
That's correct, or that's fine. I think we were both trying to make the motion, so I'm not possessive of it. You can put me, it's fine to put me.
She asking you for your vote. We're getting ready to take a vote.
Sorry, I misunderstood. Yes.
Member Gary?
Yes.
Member Hamady?
Yes.
Member Johns? Member Johns? We might lose his audio. Member Locke?
Yes.
Member Newton?
Yes.
Member Oliver?
Yes.
Member Wright?
Yes.
And Member Johns. Do we have him?
I think he dropped off. Back away.
If he dropped off, we don't have a quorum.
I'm not seeing him in the participants, so I believe he did drop off the meeting.
Can we get him back?
In the meantime, we'll go ahead and do public comment. I didn't see that we had 2 hands raised. If we can do that while we work on getting Member Johns back to complete the vote. Go ahead, Jeremiah, you're on mute.
Jeremiah?
Thank you, Madam Mayor. Thank you. So yeah, I have some notes here. You guys are on the right track. You know, for all the shout outs I've given for the fire department, I'm glad someone's heeding my advice. So yeah, get the fire department involved as much as possible. And just to remind everybody, you know, Albany's dispatching is dispatching for Kensington as well, right? So we're dispatching for Kensington. I was just hoping Kensington throws some money toward our budget. So yeah, I think you guys are doing great. I think if we do these phone calls with the fire department, bingo, number one, and send the fire department to respond to these crises, mental health. You know, I don't know about hiring a third party to do all this stuff. I just think we should just give it all to the fire department and strengthen our fire department. You know, as long as it's not the police, I guess it could be a private person. And then what happens? I'm looking at my notes. What happens when someone calls the Albany Police Department instead of 911? You know, let's say we call 525-7300, and that goes directly to the police department dispatcher. I think the police dispatchers do a good job, and I'm just kind of concerned maybe if their job's going to be taken away, where do these current dispatchers go? You know, all the years they worked in Albany, their pension's up. Oh yeah, and then let's say the fire department responds to a home with the ambulance, right? They get the person to sign their little tough pad, and they send them a $1,000 bill in the mail for the ambulance, right? Okay, but what happens when we send someone out for a mental health crisis? Hopefully there's a secured budget for that, and it doesn't have to come from the mental health crisis person. You know, that would just only add to their mental health detriment if they if we added a big bill to respond to their situation. So I'm just wondering the billing, right? How is the fire department going to respond to a mental health situation and do the billing? Hopefully there's a grant for that with the government and it's not on the person. But yeah, keep up the good work. Go Albany Fire Department.
Thank you for your comment. Next, please. Go ahead, Katie. You're on mute.
Kathy, go ahead.
Kathy, you're on mute if you're speaking. Right.
Hi, thank you for letting me talk. I really think that there needs to be a more informed response team about trauma, because there's just so much research that just came out in terms of how it's stored in the body and how it tends to be in the fight, flight, or freeze mode. And by unleashing that with that mental health crisis response team should be informed about trauma and what the latest is, because it's not just a mental one, it's a physiological, neurological response. So if you happen to, there probably are trauma experts that are available. There's a website, I think it's called Somatic Experiences, and what it's called is a trauma vortex. So that's my one suggestion, is to please, be informed in trauma. Thank you so much.
Thank you so much, Kathy. Is there anyone else? All right, I'll bring it back to the task force members. We just do, are there?
I'm not sure when Member John dropped off. I don't know if Member John needs to see the document.
Yes.
Okay, so let Member John see it, but as you bring that up, Member Newton, your hand is up. Go ahead.
Well, far be it for me to agree with Jeremiah, but he understands what we're doing differently than I do. He says we're going to lose dispatchers, they're going to lose their pensions and all that crap. That isn't the way it is it?
No,
Oh,
that's not
no,
what I,
no.
No, it's-
So you,
remember.
I'm sorry. So what we're doing is we're taking unit of X number of people designated as dispatcher, and rather than them operating under a culture of authority and enforcement, we're moving them under a culture of community service. The same people are being moved. They're still being employed by the city. The pensions still stay the same. We're not firing anybody and hiring any new people. It's about your shift, an administrative shift, plus additional training. Does that make sense? Am I speaking for the Reimagine subcommittee? Can someone step in and clarify that if I misspeak, please?
Yeah, I mean, that makes sense. I think it would be helpful, as one of the other callers mentioned, to have some clinical experts who have potentially, it may be that the dispatch already has this expertise, but yes, the key piece here is moving dispatch under the fire department, and there's no, we can leave it up to council as to determine how best to fill out dispatch. And it may be, it sounds reasonable that most, if not all, of the existing dispatch is retained.
All right, Member Jones, we have this document up for you. Do you have any changes or any comments or anything you would like to implement or suggest? Are you good? You're talking, you're on mute. All right, and if you can remove the document, are we all ready for a vote?
Since we had the interruptions, I'm going to call roll from start. So the motion is to approve the document as it is presented with the changes noted. Motion by Member Downs and seconded by Member Newton. Member Downs?
Yes.
Member Gary?
Yes.
Member Hamady?
Yes.
Member Johns?
Yes.
Member Locke?
Yes.
Member Newton?
Yes.
Member Oliver?
Yes.
Member Wright?
Yes.
Motion carries.
All right. Thank you so much. And next we'll move down to line item 6.2. That is the Budget and Data Subcommittee report. I'll turn it over to Member Wright, please.
We did not meet during, hold on a second. Yep. We didn't meet during the off period, so I have nothing to report at this time for the finance.
And I think Member Newton, you were speaking earlier about something. If you want to go ahead and speak on that.
Okay, except I really don't have anything to add.
Okay.
I was trying to get things clarified and I didn't do it. So we have nothing to report.
Okay. Would you need more time? I mean, would you want to advocate for just that section of the budget review, or because this will be our last meeting? So if you get more information, how would you like the council to receive it, or go ahead?
It's our last meeting, so it doesn't make any difference.
I mean, I would be willing to advocate for just for the budget review to give more time because of, the loss that Member Long had.
No,
okay.
No.
Okay. Just throw it out there, Member Wright?
Yes, that's it.
All right. Well, with that said, I would like to thank all the members on the task force that was able to participate these 9 months. I appreciate your hard work. I will miss you all. And I hope you all have a good evening. Thank you so much.
Thank you.
Bye-bye.
Meeting adjourned.